Hello, everybody, and hopefully we get some people watching us. So I am Dr. Bree Oatman, and I am joined by Dr. Amanda Bachmann, and we are both members of the Hughes County Democratic Party in South Dakota, and we thought it would be fun to start this program called Couch Caucus, where we basically just kind of gab about whatever issues are kind of going on in our state at the moment, especially since we're in the state capital. And for those of you who missed it, our governor had a press conference yesterday about COVID. And basically, it was kind of her usual routine of just spinning the false information and stories that she likes to spin. And so we thought we would kind of rehash some of that. And so if you are watching from Facebook, you can totally ask questions or comment, and we will see that from where we are broadcasting. And or if you're watching from YouTube as well, we can see those comments too if you comment on there. So with that, I am going to share we've kind of put some slides together. So I'm going to get that up on the screen. Go back to the beginning. All right, so here we are. This is Couch Caucus episode 1, the big nope on Noem's 1118 presser. And the first thing I will bring up is just she mentioned something about education, and my background is in education. That's what my PhD is in. And so I'm really passionate about schools and education and equity in education. And so clearly, and I'm a former teacher. And so, anything about like the whole impact of COVID on families and on students is really significant. Like there's no one going to deny that. And, but like right now, the priority really should be on social emotional well-being of our kids and their families, and just kind of focusing on that, because the benchmarks we create for learning and academic achievement are arbitrary benchmarks that have just been created by somebody that says you need to accomplish this by this grade and so on. And so in the big picture of things, in terms of this pandemic, it really doesn't matter if a child isn't at grade level for a subject. And so for all the parents out there, just like deep breath, it'll be okay. So what Noem meant to say in her presser was that based on some research out of Brown University, which I think we can all agree is pretty reputable source, that because of schools closing in the spring, that we would likely see our learning gains in reading and math be less than they would normally be, even accounting for like the normal gap that happens over the summer. And so what she meant to say, I think, is that we would likely see that reading gains would be 68 to 70% less, and that the math could be 37 to 50% less. And she pretty much just kind of botched that completely. And so I went and looked it up, and basically I'm going to give her a pass on this one because she just didn't communicate very well. All right, so the next one we wanted to talk about was prisons. I don't really think she actually brought this up. Do you remember?
No, she didn't. Amanda? She didn't bring up prisons directly, but South Dakota, in addition to having some of the highest per capita infection rates of COVID, we also have the highest per capita rate of incarcerating our citizens. So all of her talk about freedom is honestly pretty hilarious, considering how many people we put in prison. 50% of those folks are there for drug-related charges. And we all know that November 3rd, South Dakotans passed Amendment A and initiated Measure 26, the medical marijuana and the recreational marijuana. So, going forward, hopefully we're not going to have nearly as many folks incarcerated because those things are no longer going to be crimes. 62% of our inmates have contracted COVID, which is, absolutely mind-boggling. We've had 3 inmates that have died so far from COVID, and honestly, none of them were in there for offenses that warranted essentially a death penalty. I know the South Dakota ACLU talks a lot about smart justice initiatives and has been working to reform, incarceration in South Dakota, and it's definitely an uphill climb. And this is something where we need more people to be involved and more people to care about the folks that we have in the prison system. If we as a nation truly believe that in restorative justice and in incarceration, being a place for people to rehabilitate, we can't have our prisons, essentially being, death sentences for folks during this pandemic. I'm sure that Noem is not going to address this in any future press conference. It feels like her current press conference just happened because she was getting a lot of heat for not making herself available to the local media. Oh, and the last bullet point there, as far as the demographic makeup of our state, 9% of our population is American Indian, Native American, and they are 41% of our inmates. So we've also seen on the DOH stats that they are also disproportionately being infected by COVID, partially due to, these prison statistics. But, our non-white populations in South Dakota are being hit harder, by this virus, and the lack of care and attention that Noem is paying to what's actually happening in the state. She's really showing that she doesn't care. She doesn't care for the non-white population, the non-white South Dakotans. And yeah, just, here on my sofa, just being mad all of the time.
Yeah, I mean, just to kind of piggyback on this last comment about the our American Indian population in our state, kind of getting back to the education thing too, our legislature, even when they met this fall to talk about appropriation of the COVID care money, basically said no, that the reservations don't need extra money, which is, yes, our tribal schools are run separately from our public school districts, but in actuality, many of those tribal schools have partnerships where they're a joint public BIE type of school. But even setting that aside, they're still South Dakota children. And so why wouldn't you give them the money and the resources that they need? And what's interesting is in the presser, she talked about the K-12 Connect program, which is helping kids get access to internet. 60% of people in rural parts of the United States don't have adequate broadband internet. They don't have adequate cell service, all those kinds of things. And so there's this huge digital divide, but in Indian country, it's like 65%. And so I'm not sure if the K-12 Connect money is available to families on the reservations. That's not clear in any of the documents that are provided by the state for that program. So that's something I want to follow up on later. I certainly hope that it's available because, again, it's just one more, if it's not, it's one more example of kind of that, these continued kind of policies that pit the, basically it's colonialism, it's racist, it's a prime example of institutional racism in our state. All right, so the next thing we wanted to talk about is the deaths from COVID. I think one of the things that just really upset me, and we have a few slides for this, but one of the things that just really I walked away from, and I noticed this in a lot of people's comments on Twitter and other places, was just her whole, first of all, I think this month is the first time I've actually seen her acknowledge on social media that these deaths are tragic and that people are grieving. Honestly, I feel like this is the first time she's publicly kind of come out with that kind of statement.
Yeah, there was a classic Ian Fury tweet.
Yeah. And so then, it's doesn't seem very sincere, it's taken you this long kind of deal. But even now, it's she just seems to be dismissing these deaths, oh, well, it's not that big a deal because it's just the older population, or it's not a big deal because these people had pre-existing conditions. And so it's the signal she's giving is basically that, first of all, if you don't have these conditions, you'll be just fine and hunky-dory and you don't need to worry. And then I also just kind of felt like it was this, well, if you get sick because you're obese or have diabetes or heart disease, that's your fault because you made bad choices in terms of your lifestyle to get sick. And, but even just then, just thinking about just our loss of elders and everything else, I know, Amanda, you've kind of done some other analysis of the numbers in terms of deaths and everything else in terms of your risk of dying. Yep. But what I've pulled up, what people can see on this screen is on the right is basically our total cases by age population, and I know it's a little fuzzy, but these two tallest bars are the 20 to 39-year-olds. So you can see that really like COVID infections in South Dakota are being driven by people who are working, people who are out socializing, they're going to bars and all these other kinds of things. And, you know, they're getting together with their friends. But the people who are most significantly being impacted in terms of death are going to be our grandparents and our parents, in some cases, our elders. And so that's what the graph on the left is showing, is the overall number of people who have died by age. And this tallest bar, it's 394 deaths, which is 80 people who are 80 years and older.
Yeah, and pretty consistently the stat, if you get COVID and you are over 80 years old, you have essentially a 12% or 1 in 8 chance of dying of COVID. And you know, when we talk about risk, and humans are absolutely terrible at assessing risk, which is, you know, part of the reason why we are where we are right now with COVID. But when communicating about risk, if you've got a 1 in 100 chance of something happening to you, that's considered to be high risk. For our over 80 population, those folks that get COVID that are over 80, a 1 in 8 chance. That's beyond high risk. That's, you know, essentially we are solving our nursing home crisis by killing our over 80-year-old South Dakotans. And it seems weird to say this, but my grandparents, the last one died in 2012. And so I am, you know, terrified for my parents' generation, but I'm not a person that has to worry about my grandparents dying from this because they've been dead for almost a decade. And it's just stunning that a state that claims to be so pro-family is so willing to throw our grandparents just straight under the bus, 6 feet under, in, I don't know, service of freedom and liberty. It just, lots of rage. But yeah, and looking, you know, Bree, your point about the age range that's driving this, and, you know, these are folks that are, you know, working, you know, perhaps have kids in schools. These are also the folks that are, you know, working our essential jobs, you know, in, you know, nursing homes, in our medical facilities. And, you know, there's that graphic that's been going around about, you know, this is what you think your bubble is, but then like, this is actually what your bubble is. You know, every decision that we make, you know, we don't know who we're running into at the grocery store, or, you know, if you're having drinks in a bar, it's just stunning. You don't know how far, you know, this virus can go from the decisions that you make. So if nothing else, you get nothing else out of this, wear a mask.
Yeah.
Wear a mask. This is also why Couch Caucus is Couch Caucus virtually, because we can't hang out together.
No. All right. So, okay. So we're gonna, I'm gonna move on to another slide related. So this gets into some of that pre-existing condition stuff. So, you know, in my past life, before I was in education, K-12 education formally, I actually worked in public health and in prevention work. And, you know, one of the things that just kind of like floors me about her position on all of this, and was a little disturbing, even just like hearing the weekly DOH press conference, was when Secretary Malsom basically said, "We work for Governor Noem." Like, you know, it was kind of like she was signaling like we, you know, and that was in reference to somebody asked about mixed messaging that's coming out of the governor's office versus DOH and CDC and so on. And that was her response, like, we work for the governor, which basically translates into, you know, we're not going to put out the most accurate, correct, you know, scientifically based public health prevention information, because that's not what the governor wants us to do. That's not the message that she wants us to be giving. And, you know, what really frustrates me about all of that is that, you know, I think, you know, that ultimately, because that means that we're going to have more people getting sick, we're going to have more people dying. And so we have this major catastrophe in the works in our state. And, you know, and she'll dismiss it and say, oh, well, you know, we're doing better than expected because, you know, Dr. Fauci said we'd have 10,000 people in the hospital based on modeling in the spring, or, you know, like, or look at these other states, like their cases are going up. Like, she's constantly trying to kind of deflect from like, what is the reality on the ground in South Dakota and what are people facing? And so it's like she's trying to, it's, you know, in essence, she's invalidating our lived experiences with this. But what I did is I went and looked up some of our health data for the state, and this is all from the Department of Health's website. So, you know, to say like, oh, well, you know, the people who are dying are just people who have these like underlying conditions. Like I would say almost everybody has some kind of underlying health issue. And Amanda, what did you say earlier today? You like texted me and said something about like in the rest of the world, pre-existing condition. What did you say? It was
so there was a tweet that I came across at some point, and this is, you know, one of my like blessings and a curse is I'll like read things and I remember them forever. And the tweet was saying, you know, in the rest of the world, a pre-existing condition is just considered medical history. And so in the United States, like we've weaponized people's medical histories. And so Bree, the conditions that you've looked up, we've got heart disease, diabetes, and being overweight or obese. You know, things like heart disease, you know, diabetes and cancer, those also all have a genetic component. So it's not like this is some sort of pull yourself up by your bootstraps, you made poor life choices situation. There are people that are genetically predisposed to get cancer or have diabetes. Like, you know, it's not about a lifestyle choice. And we have this very Puritan idea that if you're poor or if you're in poor health, that it's a moral failing. And it's truly not. I mean, you know, as a person, you know, every human being has dignity. And the fact that Noem is cool with saying, oh, they were overweight, they deserve to die is absolutely atrocious, considering also the fact that I'm sure, you know, a lot of her voters fall into, you know, one or more of these categories. And she's just apparently that confident in her 2022 reelection chances that she doesn't need those votes.
Yeah, I mean, and so just to kind of explain some of the stuff that's on the screen too. So like first of all, like 68% of South Dakotans are considered overweight or obese. And if that is like, so that's, you know, we have 880 some thousand people in this state. You know, so that's like a huge amount of people that are at risk for having really horrible outcomes if they get COVID. And, you know, for her to just kind of be like, well, you know, it's just that group of people. It's like, well, that's really bad public health policy. It's like totally outside of anything that anyone would do in terms of prevention, mitigation kind of work. And, you know, and especially in terms of messaging, like, it's just like, you know, and then, you know, her response is, well, then those people should like, you know, isolate or stay home. And it's like, well, we can't because you don't have any orders for us not to work. Right. Like,
yeah. And there's, you know,
you have to go to work.
Yeah, there's no wage replacement. You know, some of those COVID dollars that she talked about at the very beginning of the press conference, and how we still have, you know, like 500 million or something ridiculous still to spend. And she's, you know, keeps asking for an extension because, you know, those dollars, the ways that she can spend them are apparently ways that she doesn't want to spend them. But yeah, you know, the folks that are high risk, that have, you know, these risk factors also do not necessarily have the privilege or the economic means to stay inside. And, you know, nothing is going to kill our economy faster than having all of our workers dead.
Yeah, you know, and so that kind of gets at, you know, she turned down additional money for unemployment. She keeps touting how like our employment numbers are improving, which is great. But if a subset of the population needs to self-isolate or work from home or whatever because of health risks, then, you know, I mean, especially in a right to work state, there needs to be some kind of directive from the government to say, these people are protected from being fired. Here's, you know, some supplemental income or support for you to be able to pay your rent or whatever while you know, if you can't go out and do the things that you would do because, you know, for your job or whatever, because you have these health risks. The other thing I want to just kind of point out is that COVID is now the third leading cause of death in South Dakota. So the top is heart disease, and that 3% in parentheses is actually the based on, like, I looked at like the number of people who died of heart disease last year and then our overall population, and it's basically like a 3% like if you think about like your risk of dying, like that's 3% of the population basically. And then cancer, it's like 2%. So, but both of those, heart disease and cancer, it's like, I think it was about 1,200 or so people. And then the next leading cause of death was like accidental deaths, and it was like 400. So COVID, most definitely, we're at 705 deaths as of today, is like surpassed, almost doubled the third, what the traditional third leading cause of death was. And even on a national level, where we're now today at like 250,000 people have died, which is actually just shy of how many people died of influenza last year in the entire world. So like, if, so people bringing up the whole, like, oh, it's just the flu, need to just basically shut up. Like, it's just nuts. Like only 30 some people died in South Dakota of the flu last year. And the average hospital stay for COVID is like 3 weeks, not, like, it's just like, it's just super, super frustrating for me to just kind of think about that. But, I think about these numbers, like, you can say, oh, 9%, that's not a lot. But if you take 9% of 880,000 people, that's a good chunk of people. That's like 79,000 people, I think. It's right around, it's upwards of like almost 80,000 people. And so that's a lot of people. And this is a small state. We all kind of know each other. And, that's the part that just really kind of bugs me in terms of her messaging.
Yeah, and on the note about sort of those raw numbers, Governor Noem shies away from talking about some of the things per capita. I think she likes to revert back to our raw numbers because, yeah, we're a low population state. So 705 deaths statewide, yes, pales in comparison when you're stacking it against the total number of people that have, died in New York City. But per capita, when you look at the folks who are touting, herd immunity and, looking at the numbers of what it would take for us to get to herd immunity without a vaccine, which is really just a fun way to say genocide, the estimate is that 2.3 million people would die of COVID on our way to herd immunity. 2.3 million people is like almost 3 South Dakotas. That's like taking South Dakota and wiping everybody in the state out about 3 times. Like, that's what you're saying. Like, that's what you're cool with when you say, like, let's go for herd immunity.
Yeah, and I think I saw, I don't remember where I saw it, but it was something like, if we were to, in order to achieve herd immunity in South Dakota, we would need to have over 2,000 positive cases per day for like 6 months. Yeah. And I don't even remember what the death number, what that was. Like, it was just astronomical. But I feel like at the rate we're going, like, our COVID death rate will be the leading cause of death in South Dakota by February, if not sooner, if we don't do something to change what's going on. And so this slide is really kind of talking about the hospitalization stuff. And, this has been this big deal, like, ever since the beginning. Like, it's the message is like, oh, well, it's all about hospital beds. It's like, as long as we've got X number of beds, we're going to be fine. And then, everybody's been kind of scratching their head like, well, wait a minute, like, is that staffed beds or just total beds? And, and in reality, like, again, this is a small state. It's not like we have a whole lot of hospital beds. I mean, and we have these like healthcare deserts where you have to drive hours just to get to like a regular, like to get to a specialist or anything. And so they finally, DOH finally started to identify and delineate an adult bed versus NICU or children's. So they were like padding their numbers by saying we have all of these beds, when in reality, some of those beds were for like newborn babies who are preemies and children who are in a pediatric wing. And so it's like, come on, we're not going to put adults in those beds. Like, that's just really, really not cool. So they finally parsed that out. And that's what you can see on the right is, in reality, almost 50% of the ICU beds in our state are currently occupied by COVID patients. And there's like 15% of our ICU beds left in the state. And if you look at it by hospital, which DOH is finally doing now too, where you can actually see it by region, like, some areas are worse off than others, I think, in terms of bed availability. And I have family members who are in healthcare, and we're sending patients out of state. And that's been the thing too. Like, we've had there was a huge public thing about, a patient who died, and and the state denied that he was even sent out of state. Like, they're basically saying, well, he's lying that he didn't get sent to a hospital in Minnesota. It's just kind of astounding. So the other thing that this is showing is the total number of hospitalizations by age. And what I went and looked at then was the number of people who have ever been hospitalized and then died. And so the bottom right corner is the percentage of people who were ever hospitalized within an age group who died. So 23% of people who are 80 or older that ended up having to be hospitalized for COVID died, right? So as soon as you're hospitalized, like, your risk of dying just goes up in a phenomenal amount. And that's what's really, like, we're not, in addition to just like the burden on our healthcare workers and how they're just basically kind of being crapped on by our administration, it's just like, this is, to say like, oh, well, we've got enough beds. It's like, yeah, but if people get to the point where they need to be hospitalized, like, that's really bad. And, we're just kind of like glossing over that. And then, what I'm really interested in too is like long-term health effects, like thinking about long haulers, or even just people having access to their regular care, right? Like, so as our hospitals become overburdened, can people still get in if they've got heart disease or they think they're having a heart attack? Like, how many more deaths are we going to have from other things because somebody didn't go to the emergency room because they, were worried about getting infected, or they, couldn't get in? Those are the kinds of things that are just kind of completely glossed over with this.
Yeah.
So I'll let you take this one, Amanda.
Yeah. So I just, right before we did this, hopped on a call about the Medicaid expansion effort in South Dakota. So Governor Noem had the opportunity to expand Medicaid during COVID, and didn't. So that was fun. Also, South Dakota, we are one of 12 states that did not expand Medicaid a couple of years ago, when we had the opportunity to also get some federal dollars to make that happen. And so because of this, there are going to be petitions out there circulating soon to get Medicaid expansion on the ballot in 2022. Both, I think they're doing the same kind of strategy as the marijuana, having an initiated measure and a constitutional amendment. I know they talked about the two different signature totals, so there are going to be two petitions out there happening. But yeah, we've got patients denied care out of state unless they're pre-authorized by South Dakota with the whole like Medicaid shenanigans. And that just adds another layer of complexity for our COVID patients. It also, makes it more difficult for them to get care, especially as our South Dakota healthcare facilities are, they are sending folks out of state as different parts of our medical infrastructure fill up. So definitely, if you are interested in the Medicaid expansion effort, either as, helping us to circulate petitions or just being willing to sign the petitions, keep an eye out, keep following the Hughes and Stanley County Dems. We will have petition circulators locally, doing our best with the COVID precautions so that folks can sign, with masks and sanitized pens and all that fun stuff. But South Dakota has a good track record of getting things on the ballot and getting things passed as ballot measures and amendments. And I think we can do it. With expanding Medicaid.
Yeah, and I actually, when I was doing some research on this, I found an article that talked about how even just recently, this article came out in October, but it basically talked about like how our enrollment of children in our state we've basically kind of lost like I think it was like 60% of kids who are eligible are suddenly not enrolled. They're no longer enrolled. And I don't know if that's because people missed. I mean, obviously the enrollment deadline, by the way, if you're even outside of Medicaid and you're looking to enroll in an insurance, that's all kind of happening now. So that's like the national kind of window for enrolling in healthcare. A health insurance plan is through mid-December. And you can find more information about that. So, and we'll post some websites links for that on our Hughes County page on Facebook for people to access that if you're needing health insurance. But, it just basically talking about like, a lot of children now no longer insured. And so, but, the 44,000 people is a lot of people who would be eligible if we'd expanded Medicaid. And I think the overall increase in cost to our state was like, we've got $19 million sitting in the coffers basically of the government that aren't even COVID related. Like we just had this massive surplus from this year. And I think the Medicaid expansion was like maybe $3 million more a year. So it's really not even that huge in terms of the amount of money that the state would have to expend. And if you think about it in terms of total like prevention costs, it's really significant. And the biggest outcome that they're seeing from these studies with Medicaid expansion is that the states that did not expand Medicaid have higher rates of mortality, higher rates of infant mortality, higher rates of maternal mortality, and just in general, like, more people are dying because they don't have access to adequate health care. And, and so that's kind of a problem. I think my dog's about to get on camera.
I saw a nose coming in.
So if you see it black out, it's because my dog's sitting like right behind the computer on the couch. Anyway, it's just, this is one simple thing. Like that executive order was, I think at the beginning of summer that she could have signed to expand Medicaid and she didn't. So it's just one, it doesn't impact people, it has nothing to do with masks or lockdowns or anything. I just think about like I keep wondering about that. How many people don't have insurance and then don't go get a COVID test, or they don't seek medical help because they're worried about what their medical bills are going to be. And I know like the COVID test is like over $200. So if you don't have insurance to pay for that, that's a big deal.
Yeah.
Okay.
Masks. All right.
All right. So before we get into this, I need to check something because I'm wondering if we have people.
I see that we've got 3 people
chatting, and I realized I didn't have the right thing open for us to see any chat. So I'm not sure if anybody's commented from Facebook or YouTube. I don't see anything yet, but I'm going to send out a comment. And we'll see if that gets people. All right. So now I'm going to go back to showing. Oh, I guess I could still be in this. No, because I have to be able to advance the slide. So I can't see the chat. Amanda, you'll have to kind of field that because.
I can see it.
Okay. So
this
next one, Noem, she's just going to it's like she's just kind of, I think she's just so far entrenched in this mantra about the mask thing that she's just got to double down, and it's just like that is the thing she's gonna just like sink her ship on.
Yep, that is the hill that she is going to die on.
Oh, it just drives me crazy. And here's the thing that's what I find really interesting is that Representative Dusty Johnson is like putting out his own little PSAs about people masking up, and there are plenty of Republicans out there that are doing that also, but she just kind of like glommed on, she's whole hog on the, the whole, the Trump camp. And it's just like, I just keep thinking about this, like without even having to like mandate it and make it a law or do anything about lockdowns or whatever. Like if she had just from the beginning, in addition to our president, just like put on a mask and said, yes, we're all going to wear masks because it'll help prevent the spread of this disease. Like, imagine how many people would be willing to do that right now versus what's happening, which is just this like crazy, like, I don't know. I just feel like it's this like mean. I mean, I have a 3-year-old and I feel like this is like, I'm dealing with adults who are channeling their inner toddler because they just like, they're just on this bandwagon of doing this. Like it's been politicized to the point where it's like people's lives are on the line. And that's what makes me really angry about this. So, Amanda and I have our PhDs. We're both like really smart women, and we know how to like dive into the medical literature and the research. And that's been my biggest thing too, is Noem just keeps like touting, like citing sources that are complete bogus. Like they're just like total BS sources. Like I remember that Rapid City article, the Rapid City Journal article where she was all upset because the Argus wouldn't carry the article or her letter or whatever. And she cited like a blog post by an organic chemist working for some conservative think tank. And Massachusetts or something. And I mean, I'm just kind of like, that is not like, go to the primary sources. Like, it's not a valid source. And I think I remember commenting, like, if you were one of my students and this was your paper you turn in with your sources, I'd hand it back to you and say, try again. Like, it's blah. And she keeps going back to stuff from like April or March.
Yeah.
So I went in and, so for those of you who aren't in this kind of camp of like what scholarly research looks like, first of all, it needs to go to a peer-reviewed journal, which means you submit a manuscript and there's a bunch of people who are also experts in that field that review your manuscript and basically tell the journal yay or nay. Like, it seems like your stuff is legit or it's not. And that's kind of the whole process. And so for like early studies, like for like there to be like a case study about, like the ibuprofen thing's a great example, or the hydrochloroquine, to have like one person in a case study is not valid data. So there's this other form that you can do called a meta-analysis, which is basically where you go and you look at all of the studies that have been done within a certain parameters, and you try to look for patterns in their reporting of their data to see like, what emerges. And so I went and looked for some of those, and I have two cited right here. Basically between the two of these, over 200, they're representative of over 200 studies related to masks, including the use of cloth masks. And, Governor Noem, she said, not and the N95 masks are the masks that work the best. And absolutely that is true. But cloth masks are effective in preventing disease. And I think what drives me crazy is people get into this thing of like, well, it's got to be all or nothing. Like, it's not 100% effective. So, why bother? It's like, well, condoms aren't 100% effective either, but we still recommend them to prevent sexually transmitted diseases and pregnancy. Brushing your teeth is not 100% effective in terms of, like getting a cavity, but we still recommend that you do it twice a day. So, that's the kind of thing that I just like, I don't know, it's kind of crazy. So this infographic talks basically is a great depiction of kind of like why we need to wear masks. And I picked it because it shifts, like the focus has been like, well, Noem actually said that if you're scared, stay home. And it's like, well, that's not really the point. The point is you wear a mask because you could be asymptomatic and spreading the disease to other people. And if the carrier is the person wearing the mask, then there's even less risk of it being spread than if it's the non-carrier wearing the mask. And so, Amanda, I'll let you kind of chime in on this.
Yeah, I've listened to too many of the like city council meetings about the mask mandate. So I listened to the Brookings one when that happened. I listened to the Sioux Falls one. I was pleasantly surprised by both Huron and Mitchell. I did not listen to theirs. I skipped out on listening to the Rapid City one tonight because I've just, had enough of the Parks and Rec bingo for 1 week. But if the anti-maskers and the mask deniers, anything that they can come up with, I have officially heard it and rolled my eyes entirely out of my head. But yeah, and I too remember like super early in the pandemic where Dr. Fauci was even saying, we really weren't sure about cloth masks early on and like how this was going to go. And there was also that PPE shortage for nurses and doctors, and so Fauci didn't want folks hoarding that PPE that our medical folks needed. So there was some confusion early on in this. But the thing about science and data and facts is that as we get more information, our recommendations get better and better. And so every time Noem or one of the anti-maskers cites something from April about masks, I want to kick a puppy. Is pretty much like how, and I really like dogs too. So, but yeah, citing stuff from that long ago, it's not truthful, it's not accurate, and it's not how we should be communicating about a public health crisis. Yeah, like wear a mask, put a mask on your face, make sure it covers your nose and your mouth. I think what the next slide has all of the the fabric type. So we'll talk a little bit about this. And I know early on too, before everyone had sort of like, gotten into like mask production, There were the CDC how-to to, turn a bandana into a mask and all that fun stuff. But truly, like, something on your face is better than nothing. There's also people have been looking at viral load, so how much of the COVID or how much of the coronavirus you pick up potentially has an impact on how severe your illness is. And so wearing a mask, even if it doesn't entirely prevent you from getting COVID, it might reduce that viral load enough that maybe you get to experience a mild case of COVID versus getting hospitalized and then, increasing your risk of death. So looking at this graphic, the most effective masks are going to have multiple layers of fabric. So if you are putting something on your face that is just one ply, figure out a way to double it up. A lot of the masks that people have been making have at least 2 layers of fabric, and a lot of them also have a pocket where you can insert an extra filter if you want to. Full disclosure, I wear a lot of the cotton 2-ply masks. I don't really get into the extra filter thing, but that's just me and sort of what I have.
Yeah, and then I would just say, like, tea towel, like, people are like, what does that mean? Like a really tight weave cotton, basically.
Yeah.
So think about like quilting fabric. And that's what we've been like, we use quilting fabrics to do that. And so, hey, you want to say hi to people? I'm on camera. This is Lena. We're talking about masks. How's that going wearing them at school? Middle schoolers able to handle it? Some. So, so I just want to say something about that, again, getting back to like Noem bringing up schools reopening and how we need to have kids in school. And obviously our cases are going up with schools, and some schools are having to close. Not all schools have implemented masking policies, but, and I tried to find some information on that. And I couldn't really find any statewide data other than like total number of cases in K-12 settings. But in Pierre, we started out the school year where they were kind of like, it's encouraged that you wear one, but, it's not required. And really, and what frustrates me again about this, which is similar to kind of even just like Noem's position with this in terms of like the adult population, because she'll say, well, look at these states, they have mask mandates and their cases are rising. Like, yeah, and that's because of noncompliance. And it's because there's no way to, like, nobody's enforcing it. And in terms of just, and then also just kind of having like that kind of collective, like, I'm going to do this because it's what's best for the common good versus me. But I think about this in terms of the schools, like having been a teacher for so many years, like, we've got this like huge handbook of student rules. You can't have spaghetti straps. You can't have holes in your jeans that show, above the thigh. You have to have like the thumb, think about all the stuff about girls in particular and the clothes they have to wear. Cell phones, like all of the stuff that gets policed with kids every day at school. And, and so for them to say, well, we can't monitor this. I'm like, well, no, it's just that you don't have the will to monitor it because you do all of these other things every day with students. Like, this is one simple thing. So what happened in Pierre is they were like, well, we encourage it, but it's not required. Well, all of a sudden there was a huge spike in cases, especially in the high school. They had to go to a hybrid model and have kids there alternating days. And then finally, like, okay, fine. All middle schoolers and high schoolers have to wear masks. And that was like as of October 4th. And sure enough, all the cases went down. And what I'm seeing, and I haven't seen any like actual like peer reviewed data on this yet. So it's still kind of like not, I can't confirm this in any way. But what seems to be happening is that schools that have the mask, clearly you have less cases. But what they're starting to see is that it doesn't seem like the spread is likely happening, especially if you start thinking about it in terms of contact tracing. Like, kids who are getting sick at the school, it's not really about them being in contact with other kids during school. It's what they're doing outside of school. So it's what is their family doing together in the community where they're not wearing masks, or their extracurricular activities or whatever. And that's what's going to be driving those infections. And so, like last Friday, state football, Dakota Dome, there's Noem claimed she had a mask on the whole time.
The White Walk in Deadwood.
So, she claimed she had a mask on this whole time. And there's like, all of these, we saw pictures of kids from Pierre without masks on in the stadium, and she claims, oh, I only took my mask off because these boys wanted a picture. I'm like, you're the adult. You're the role model. Like, you need to say, sure, I'll take a group photo, but I'm keeping my mask on if you indeed had your mask on. Like, that's the part where I'm just kind of like, please.
Yeah. And it's such a simple thing. Like, wearing a mask truly is so easy. I mean, I have a stash in my office. I threw a couple in the glove box of my car. I, throw one in my purse every day when I leave the house, and the ones stashed other places are in case I forget to put one in my purse. And you can get the ones with the nose, the metal nose piece, so you can really make it fit better, so you're not fogging up your glasses, and also so that you're keeping, your breath inside the mask, so it's only, being filtered by the fabric. And I know people are like, well, the virus is like, however, number of microns, it's going to get in between the weave of the fabric, and that's why masks don't work. And I, bash my head against a wall, because I have done a lot of science education. I've learned a lot of things and spent a lot of time in school, because the virus isn't traveling on its own. It's traveling on your droplets of saliva that are getting spit out of your mouth every time you talk. And those droplets are what are large enough to be trapped, by the fabric of the mask. And it's just like, people are just making so many bad arguments. It's just like, oh, it makes me a little bit nuts.
Yeah.
But yeah, so there has been some polling in the state of South Dakota about coronavirus and masks and all that fun stuff. It was through SDSU, and so Bree's got the website up.
Yep, and I need to, there was another one too that I was toggling between several of their surveys they did. So I'm not sure. Oh, it'll be this one. So we'll do this one first. So what I think is interesting is that, they've been polling. Actually, I'm going to go to that one and come back to it. So where is that? So that's because this directly relates to the whole mask thing. So, Noem is, where is it? Is this the right one? Oh yeah, here it is. So I just thought this was just super striking to me because, what's interesting is Noem is, if you think about if you look at this in terms of who's her base on this list, it's the born again Christians, it's the people who are rural, it's going to be a little bit of a mix, East River, West River, right? Mm-hmm. But she's saying, in terms of her not wanting, her not supporting wearing a mask, and other people not supporting a mask mandate. It's just kind of interesting in terms of these numbers. But, and for me, it's she could be modeling from the beginning. She could have been modeling, appropriate mask wearing or whatever, and not had to mandate it. Right. Mm-hmm. It's if you have transformational leaders who are people are going to follow, and certainly people are willing to follow her on this to their death in terms of not wearing a mask. I just keep imagining what it would have been like if she had actually gone the other way, and just thinking about these numbers. So this is what's interesting, is that you have this in terms of her base also not being in favor of masks. And then you look at the same groups in terms of the COVID vaccination. And this is what struck me, is that, during her press conference, she's like, it's wonderful news. We've got vaccines, and by the way, both Amanda and I are in COVID vaccine studies. I'm in the Pfizer study and she's in the Moderna one.
Yep.
So yes, this is amazing news. And the efficacy so far is just incredible for these two vaccines. But, now you look at this number, in terms of what this says, and it's, let me think what the question was for this one. Let's see.
I'm just very concerned about the folks that identify as born again, really apparently looking to meet Jesus a lot faster than the rest of us. Just I really don't understand this mentality of if I die, I die. I don't.
So this is the percentage of people planning on getting the vaccine. So this is exactly what I'm talking about. She's she's saying don't wear a mask, but good news, we're going to have a vaccine. And meanwhile, the same people who are also sweet, I don't have to wear a mask, are also going to be not going to take a vaccine.
Yeah.
So I think about okay, well, if this, percentage of people aren't going to get a vaccination, then, that's what does that mean?
We're still not going to have herd immunity.
Yeah, I mean, and what does that mean for like continued COVID outbreaks in our state because people refuse to get a vaccine? And so let me go back to that other one.
Well, and especially thinking about vaccination and who herd immunity protects, because there will also, much like with, flu vaccines, and, even the MMR and, tetanus boosters and, those kinds of vaccines that we all sort of routinely get, there are folks in the population who cannot get vaccinated, maybe because they are too young, or have some other, health condition that they really, are allergic to the some component of the vaccine or whatever, and can't get vaccinated. And so, that's why the rest of us need to be vaccinated as well, for those folks who can't, especially, thinking about infants. I mean, we don't want to get to a place where, essentially the vulnerable population is, people that are like 0 to 12 months old.
Yep. Which is also why everybody should get their flu shot. And that was brought up in the press conference too, because what you're basically reducing, again, you're helping reduce the burden on our healthcare system when we have both diseases kind of, that's like right around the corner where all of a sudden we have people being hospitalized for influenza. And, even if that vaccine isn't super effective in terms of preventing you from getting it, it does give you partial immunity. And so, we can prevent a lot of deaths by making sure that people get their flu shot. And yeah, I mean, I used to work in a school where I had a student with cystic fibrosis and, a coworker. And so for me, especially, it was like, I do this and it's not for me, but it's to protect other people. And that is like a really big deal. And I also remember I remember being pregnant during flu season one year, and it was a year where it was really, really bad. Like I'd have 10 kids out or more for every class. And I was just terrified of getting it because I was, at that early in my pregnancy, it was like, I would have been really high risk. And so, it was just kind of frustrating for me when people don't do their part to protect everybody else, I guess. Yeah. So, this data from SDSU is basically kind of looking at general kind of public's perceptions and feelings about the response to COVID. And this first one's specifically related to our current president. And, the redder colors are the people who are not satisfied and, strongly disapprove, somewhat disapprove, up into the blue. So, only 24.6% of our population actually strongly approves of President Trump's handling of the coronavirus, which I think is actually really, I look at this and I kind of think about like how he didn't perform as well in this state. And so that doesn't actually, thinking about this and then relating to how people voted, it's not that surprising. Mm-hmm. And then people were asked about Governor Noem. And so what I think is interesting about this is that and obviously this is going to be like super divided by like party affiliation and everything else. But, if you count the strongly disapprove and the somewhat disapprove and the neither, which are basically people that could guide and like go here nor there, right? They're indifferent about it. But basically if you combine both of the disapprove groups, like clearly, just over 50% of, a little over 50% of our population is not approving of her handling of COVID, which is, I think that's actually kind of matches, she just barely won the election 2 years ago, right? It's like she had just barely enough votes to win. And so, so I guess I'm not too surprised about this, but somewhat I am, because so many people are not wearing masks that it surprised me that her disapproval was as high as it is.
Yeah. And if you look at any of her social media channels, it seems like her approval is much higher, but then you dig deeper and realize that a lot of that approval is coming from outside of South Dakota.
Yeah. Oh yeah, I know. Like the number of like the out-of-state people, just kind of like she's got her own little like kind of fan club. And then this is like thinking about the local city government handling, and you can see that there's a much higher approval rating of how our local jurisdictions are handling the COVID outbreak. And what's frustrating though is that they shouldn't be left to be making these decisions, right? I mean, and this is kind of what's happened on a national scale, is it's been this piecemeal response versus one kind of unified message, unified response. And then, so I'm going to pull up one more and then we can kind of wrap up. All right, so here's the next one. And this is interesting because this is related to the whole mask mandate thing. Again, there's certainly more people in the state who, and in this case, people supporting is all this blue. So we have this little bit of group that could go either way, which basically means they'll probably wear a mask if there's a mandate, but they don't really care either way, right? I mean, that's kind of how I'm
reading that. Testify.
Yeah, like they're like, yeah, okay, like whatever. And they're probably already wearing one, right? So, but more people support a mandate in the state than who don't, and so I think that's kind of telling in terms of that. Just the, and the frustration I have with our elected officials not having the political will to do to make the right decisions.
Yeah. And the discussion in her press conference, and then that she again pulled out on Twitter about how as South Dakotans we're just supposed to respect everybody's choices around masks, and I think the anti-maskers are really worried that those of us wearing masks are going to be as mean to them as they have been to us.
Yeah. I know the whole that she just kind of kept repeating that we need to respect each other, and I just was kind of like, well, that's the pot calling the kettle black. I just kind of okay, yeah. Coming from the person who's who's just been really not very respectful or nice to people who have different views than her.
Yes, as we wear our "Let's Start a Riot" t-shirts.
Yeah, let's. So this is the reasons why people support wearing a mask mandate. And what I thought was interesting is because she tries to make it all about well, people wear masks because they're scared, and that's kind of well, if you're scared, wear a mask. And it's no, I'm not overly scared. I'm doing this because this is how we get out of this is how this ends, right? And especially I think about it if that high of a percentage of people isn't going to get vaccinated, right? Then this is going to go on even longer than we thought it would. But this is kind of interesting. It's most people it was protect their family, protect their. And then I think this is what was encouraging for me is that most people said it was about protecting their community. Because that's the line. Well, I can get together with my family for Thanksgiving. It's my personal choice. It's my personal decision, which is what Noem was saying too. And it's okay. But, let's look at all these weddings that now have been, studied by epidemiologists, like the one in Maine where 7 people died and none of them were connected to anybody who was at that wedding. Right. And so, it isn't about my family. It's about us getting together, and then we go out to our respective jobs or whatever and get other people sick, and it just kind of snowballs. And, and so that's kind of that piece in terms of protecting others versus, and that I think it was Cory Booker, he had a tweet the other day that it's wearing a mask is essentially this act of love, right? You're doing this to protect other people. Which
again makes me really wonder about those born again folks.
Yeah.
I mean,
I know. My whole thing too with this whole death stuff too, it's especially with Kristi Noem, because she'll issue a decree for a day of fasting and a day of prayer about abortion, and but then this just kind of be completely callous and disconnected about this whole situation. And I feel anybody who claims to be pro-life who isn't upset about how calamitous this is in our state right now really needs to reevaluate their moral outrage about the loss of innocent life, because this is we now have we have almost double the number of deaths as we've had of abortions in our state, based on the data. It's just and then just thinking about the overall health impacts and everything else. I mean, I just feel it's just that piece of it too, the whole idea of I mean, and I'm not surprised by it, but yeah, I feel like if this is your, if you're going to like tout, this like moral obligation to protect certain populations, then, you can't cherry pick who gets to be protected. So this was interesting, like why people oppose mask mandates in indoor spaces. And, I think, again, this kind of gets at like the messaging that either comes out from our public health people and our governor, like this whole idea of infringing on freedom, and I keep thinking about this, like if during World War II, there were rations, like you couldn't buy certain things. People were limited to what they could purchase. And, I try to think about like, if this pathology of individualism and my personal freedom had manifested itself during World War II, what would have happened? Mm-hmm. And it's just this kind of like, that's kind of what strikes me, like this whole infringing on freedom thing. I'm just kind of like, okay, like, I don't even know where to go with it.
Like, and especially with masks, because the thing about wearing masks is, it allows us to still, go to the grocery store, do a curbside pickup or a takeout order from a restaurant. Like, it still allows us to, go about our daily lives, like, fairly normally. I mean, still obviously, not being inside with people outside of our household, socially distancing, washing our hands, like still doing all of those other things. But I'm like, what freedom is being infringed when I put a mask on my face? Like, did I miss the part of the Constitution where it says that I should be able to sneeze on every shelf in the grocery store, like with abandon?
Yeah. I mean, and I think about like, because Noem brought up like how Minnesota's cases are going up. I'm like, yeah, and that's because most of the rural part of the state is refusing to wear masks and is kind of like, I mean, I look at like all of the Minnesota license plates in South Dakota right now. It's like, yeah, because there's like a bunch of people there that are chosen not to follow the guidelines from their governor. And now they're in lockdown again. As of today, they're in like a massive lockdown until December 18th. I'm like, imagine if you'd all just worn your masks, maybe this wouldn't have happened. Like you wouldn't be being told you can't go out to a bar anymore. You can't like, whatever. Like, it's just, yeah, I don't understand it. And and this is the whole, like the don't work well. It's like, that is clearly, I would say on a national level, like our public health experts really botched it with this, like, mm-hmm. And so I feel like, and again, I mean, you mentioned this earlier, like in the beginning, looked at our behavior with toilet paper. Then it's kind of like, don't wear a mask because we know what all the a-hole Americans are going to do. They're going to go buy all the masks and then healthcare workers won't have masks. Yep. So like, I get that. And then and obviously even just with the cloth masks, it was all about, they were worried that people would wear them incorrectly. They would be touching their faces all the time. And then they're not as effective, which that was like Noem's messaging forever, right? Like mm-hmm. people touch their faces and blah, 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 blah. It's like, yeah, but like you said earlier, like, a mask poorly worn is better than no mask at all. And yep. So it's even if the condom's expired in your wallet, you should probably use it versus not use it at all.
I mean, while that analogy is apt, I also feel like
but not really. You should just go buy new condoms. Like, don't use them.
Yeah, and I just think about all the people that use condoms incorrectly.
Oh yeah, there's a whole lot of people using them incorrectly, and that's probably where there's the failure rate, right?
Right.
All right, and so then if a vaccine against coronavirus becomes available for free, do you plan on getting vaccinated? And this is encouraging to me. Like, most of our population looks like they would get vaccinated. And by the way, like if any of you have questions about the vaccine trial and you want to know, like, Amanda and I are happy to talk to people about, kind of our experience and all that kind of stuff. But, so this is a little encouraging to me. What worries me about this, though, is like if you don't get enough people vaccinated, then you still have like spread of the disease. It's hard to like, so I don't know, like, we'll just kind of see how this plays out. But, if people want life to get back to normal, when the vaccine's offered to you, you should get the vaccine and do both doses.
Yeah, and that's the thing too, thinking about herd immunity with a vaccine is the way the vaccine has been studied. They've been tracking people and figuring out, how long those antibodies are lasting in your body. Whereas the whole immunity from infection, that's not been, really established definitively how long you're immune after you've recovered from COVID. So, get the vaccine because then you're going to know that, you're good for X amount of time versus, essentially playing Russian roulette with your immunity after a COVID infection.
Yeah. And if it's kind of like, I mean, I'm part of the generation where it was like, pretty much moms having chickenpox parties to get their kids to get chickenpox before the age of 5 kind of thing, because if you get it when you're older, it's a lot worse. But the issue with chickenpox was like, if you didn't get a severe enough case, even as a little kid, you were at risk of getting it again. And so that's the thing, like when you're exposed to these viruses and you have them just in terms of like getting sick, people have varying viral loads, varying immune response. And so there's so much variability in terms of that antibody production in your body that there's no way to guarantee that you are no longer contagious and how long you'll no longer be contagious. And we're seeing that, like some people are getting reinfected. Whereas a vaccine where that's all kind of controlled, like, exactly everybody's getting this kind of dose, you kind of know what that dose response is going to be. And then, with this study, by the way, like, yeah, they're going to approve the vaccine, but they're following us for like 2 years. So Amanda and I both, we have slightly different protocols, but we get our blood drawn at different intervals and they're basically checking our antibodies to make sure that we still have that protection. And that's still an unknown. We don't know if it's going to be a long-term protection or if people are going to have to get booster shots. So there's still some questions out there, but the vaccine is safe. It's incredibly effective in terms of its response right now, which is really, really exciting. And it's super cool from like a nerdy science perspective, because this is cutting edge with the mRNA, which also means, by the way, for people who watch this, that you are not getting any viruses in the vaccine. You're getting genetic information related to part of the virus, but you're not getting the actual virus. So you cannot get COVID from the vaccine.
Correct.
So this is the reasons why people want to get vaccinated, which again, kind of is along the lines of, the mask piece. But also, that whole like kind of get back to normal. But, like my family's in Washington State, your family's in, on the East Coast. It's like, I really just like today, my mom called me because my grandma has congestive heart failure and I haven't seen her in over a year. And I just really, really want to be able to get home before she dies. And so like that kind of thing, like that's also why I signed up for the study. I just felt like it was something tangible I could do to help make a difference and kind of end this craziness we're living in. So this is interesting. This is like why people won't get vaccinated. And I, like the whole side effects thing, I'm like, okay, fine. Like that's kind of regardless like of what vaccine it is, there's a subset of the population that just have this weird thing about vaccines. But like the other 2 columns on this graph, like I just want to scream, Noem, Noem, Noem. Like really, like you're not concerned because you don't think it's a big deal or the outbreak isn't serious, right? Or it's a hoax or whatever. Like just the whole, like, that's, again, that has to be put in her lap because her messaging as the leader of the state, like really, she could have impacted that part of that these ideas in significant ways, considering, how conservative the state is overall. And yeah, I just, this makes me cranky.
Yeah. Yeah.
Yeah. I'll just leave it
it's
at
probably
that.
a good thing that she does very few press conferences. But yeah, there's going to be sort of all sorts of content in between now and when session starts for Couch Caucus. We're not just going to cover Noem or COVID. And as we get closer to session, we are going to do, a couple of these to talk about how you can follow legislative activities and, what session looks like, how to get involved, all of that fun stuff. So we will be doing more couch caucuses. And if there is a topic that you want to hear about in a future couch caucus, or if you know somebody that you think we should bring on as a guest, feel free to shoot us a message, on the Hughes and Stanley County Facebook page, or email hughescountychair@gmail.com. And I know Bree is our social media expert, so our contact information is all on our Facebook page. And, we'll keep an eye on the comments on these videos too. If people watch any of them later or whatever, and, drop in and sort of continue the discussion. But, please wear a mask, put a mask on your face, wash your hands, socially distance, keep your bubbles small, keep your travel limited.
Yeah, the CDC says they're like begging people, please don't travel for Thanksgiving.
Don't travel to Thanksgiving. South Dakota Department of Health was like, here are tips on how to make your Thanksgiving safer. And I'm like, or you could just not travel. Like, just don't. Like, don't do it. But yeah. Any closing thoughts, Bree?
No, I had a lot of fun doing this, though. This is going to be fun when we do this. And they won't always be this long, but this was because there was so much. And we didn't hit on all of it. We probably could have done different episodes on each part of that presser. Yeah. But no, I'm excited about this. And if people have ideas, or if you want to be on one of these, especially when the legislative session starts. And I think even maybe even as a wind up before it starts, it might be interesting to kind of rehash what the big topics were last year during the session and what we think is going to probably show up this time. I think that might be interesting. And we're hoping we might get some legislators on here, maybe have a game of Among Us, some space murder with some people. That'd be pretty cool too. So, and we did a couple comments. So thanks, Josh. We had fun with this. Amanda and I are usually chatting on the fly while we're watching this stuff, and just okay, we need to just kind of go live and just filter our language. So it's family friendly.
Right.
And then there was a great comment, do traffic guidelines infringe on individual freedom? And actually what that gets me thinking about is when Noem says, well, the mask mandates, it's still people are getting COVID, it's not working. And I'm like, okay, well, how about cell phone laws and distracted driving? We can't we can't text and drive. Not everybody's compliant. But the law is still there.
Cough, Jason Rosberg. Yeah. I mean, why have civilization and laws if they're why have any of this? But apparently a mask is bridged too far.
I mean, especially because, laws are put in place for the lowest common denominator, right? The laws are there because there's always that, Noem is also, she's shown it doesn't apply to her. She'll go to the Dakota Dome and not have a mask on. So, it's there's always people out there well, this rule doesn't apply to me, speeding or whatever. That doesn't, it's just this kind of logical fallacy to say, oh, well, we shouldn't have an executive order on this or whatever, because not everybody's going to follow it. So I guess that's it for me. I can, Amanda, if you want to say the email one more time, I'll type it in the comments so it does show up. So what's the email you gave?
hughescountychair@gmail.com.
And when's the next meeting?
The next meeting, actually, let me double check on my calendar so I don't forget what day we're doing it. But our next meeting is going to be December 14th. At 7 p.m. And because of COVID, obviously, we will be doing it virtually. So there will be a Zoom link. And we do also have, an email list. I send out email reminders. So if you would like to be added to our email, shoot me a message and we'll get you on our list that way too. But yeah, December 14th, 7 p.m. we'll be on Zoom, and hopefully be a little bit of a, holiday celebration meeting, which normally we do in person with like a potluck. But again, COVID, we're not going to kill our limited number of Democratic voters.
And we have a tree.
Yes, we have a tree at the Capitol, so we'll actually be decorating that tomorrow. So, and I know the Capitol Christmas is going to be putting pictures of the trees on Facebook and doing some like virtual tour things for folks who, don't want to visit in person, which I totally get. And obviously, there's no way I'm going to be at the Capitol at any of the high traffic times. But if you do go see the trees in person, definitely make sure to mask up. And keep your distance from anyone else that's there. And I would say avoid the musical performances, because those are definitely ways that spit travels long distances.
Unless the performers are also wearing masks.
Right, which I've met Pure, South Dakota, and I'm going to say that's highly unlikely.
I know one tuba player that would.
Right.
All right, we're going to go. Thanks, everybody.
Yep, thanks.